Psychological disorders, sometimes called mental disorders, are common around the globe in all countries and all societies. Psychological disorders account for the greatest amount of disability in developed countries, surpassing even cancer and heart disease. In any given year, about 1 in 4 Americans over the age 18 has a psychological disorder. Nearly 1 in 2 Americans will develop some form of psychological disorder at some point in life, most commonly depression, attention deficit hyperactivity disorder, also known as ADHD, an anxiety disorder, or a substance abuse disorder. There are enormous differences in psychopathology across the sexes. Some disorders, such as depression, are much more common in women. Others, such as antisocial personality disorder and childhood ADHD, are more common in men. Most of us have felt really sad on occasion or anxious when facing some difficult challenge. How can we tell if those feelings are a reasonable response to the situation or an indication of something more serious? Drawing the line between normal emotions, thoughts, and behaviors and a psychological disorder can be difficult. After all, different people respond to events differently, and the level of personal suffering is hard to measure objectively. However, as a rule of thumb, when the emotions, thoughts, and/or behaviors disrupt a person's life, cause significant distress over a long period, or both, the problem is considered a disorder rather than merely a low point of everyday life. At this point, the symptoms reflect psychopathology, a sickness or disorder of the mind. How do you know if someone is experiencing psychopathology? Behavior, especially unusual behavior, must always be considered in context. A woman running through the streets screaming, sobbing, and grabbing and hugging people might have some form of psychological disorder, or she might be celebrating because she just won the lottery. Many thoughts, emotions, and behaviors that are considered acceptable in one setting may be considered deviant in other settings. For example, some Native American and East Asian cultures consider it a great honor to hear the voices of spirits. In urban America, this would be seen as evidence of auditory hallucinations. So if your intuition is not enough to determine whether someone is experiencing a psychological disorder, then how can you tell? In deciding whether something is psychopathology, it's important to consider 4 criteria. 1, does it deviate from cultural norms for what is acceptable? In other words, does it vary from how a person is expected to think, feel, or act in a given situation? 2, is it maladaptive? That is, does the thought, feeling, or behavior interfere with the person's ability to respond appropriately? 3, is it self-destructive? Does it cause the individual personal distress, or does it threaten other people in the community? And 4, does it cause discomfort and concern to others? These criteria are important, but there are some problems with each one. Therefore, psychopathology is increasingly defined as occurring when thoughts, emotions, and/or behaviors cause significant distress, impair good daily functioning, or both. For example, people concerned about germs may wash their hands more than average, and that behavior deviates from the norm. On the one hand, such behavior may be beneficial. After all, it is the best way of avoiding contagious disease. The same behavior, however, can prevent people from living normal lives if they cannot stop until they've washed their hands raw. Indeed, the diagnostic criteria for all the major disorder categories require that the symptoms of the disorder must interfere with at least one aspect of the person's life, such as work, social relations, or looking after oneself. Must cause significant personal distress, or both. These criteria are critical in determining whether thoughts, emotions, or behaviors represent a psychological disorder or are just simply unusual. To fully understand any disorder, psychologists need to investigate it from 4 perspectives. First, they have to determine etiology, the factors that contribute to the development of the disordered thoughts, emotions, and/or behaviors. Second, they need to identify and assess the symptoms of the disorder to understand what is occurring. Third, they must group symptoms into meaningful categories to make a diagnosis. This process of categorization and diagnosis is critical to the 4th perspective, which is identifying possible treatments. For example, the causes of depression may be quite different from the causes of schizophrenia. Likewise, people with depression may show different symptoms than people with schizophrenia. By grouping people into disorder categories, you can look for what is shared by the people within these categories. You can then explore what treatments might help people with similar symptoms. This unit will look at how psychologists generally view the causes of psychological disorders. And before we begin this unit, we need to understand why it's important to avoid the temptation to diagnose someone with a psychological disorder. As you learn about different psychological disorders, you may realize that someone you're close to, a friend, a family member, or even yourself may be experiencing impaired thoughts, emotions, and/or behaviors. However, even if particular symptoms seem to describe a person you know perfectly, you must resist the urge to make a diagnosis. Remind yourself that medical students sometimes worry that they have every disease they learn about. Like those students, you should avoid analyzing anyone, including yourself. Only clinicians can properly assess a person's mental health status. However, what you learn in this unit may help you understand mental health problems you or someone else might experience, and you can use that knowledge to help yourself or support the person in getting proper diagnosis and treatment. Psychologists do not completely agree about the causes of most psychological disorders. Both nature and nurture make people who they are, so it doesn't make sense that either biology or environment is solely responsible for a given disorder. At the same time, psychologists have general ways to view the causes of disorders. The diathesis model offers an explanation for the mechanism that leads to a psychological disorder. This explanation is based on two factors. First, an individual may have an underlying vulnerability, a predisposition, which is known as a diathesis, to a psychological disorder. This vulnerability can be biological, such as a genetic predisposition to a specific disorder. Alternatively, the vulnerability can be environmental, such as a childhood trauma. By itself, the vulnerability may not be enough to trigger a psychological disorder. Instead, the disorder can be brought on by the addition of a second factor, which is stress. If the stress level is more than the person can cope with, the symptoms of a psychological disorder may emerge. For example, the stress that a person who experienced bullying may have been a factor in the decline of their mental health. In short, according to the diathesis stress model, a family history of at least one psychological disorder raises the possibility that someone may be vulnerable to mental health problems. A family history does not mean that a person will develop psychopathology. Instead, the person's environment matters. Is the environment creating the kind and amount of stress that might push the vulnerability into a disorder? As you can imagine, maintaining good mental health in yourself and others involves managing the effects of stressors. The diathesis stress model focuses on how stress can trigger psychological disorders in people with vulnerabilities to them. Today, most psychologists recognize that in addition to vulnerability and stress, several factors contribute to psychological disorders. As the name suggests, the biopsychosocial approach states that most psychological disorders are influenced by biological, psychological, and sociocultural factors. The biological aspect of this approach focuses on how physiological factors like brain function, neurotransmitter imbalances, and genetics contribute to psychological disorders. Studies comparing the rates of psychological disorders between identical and fraternal twins and individuals who have been adopted have revealed the importance of genetic factors. The psychological aspect of this approach considers that thoughts, emotions, personality, and learned experiences influence the development of psychological disorders. Lastly, sociocultural factors, such as family relationships, socioeconomic status, and the cultural context in which a person is born and raised, are related to the development of psychological disorders. Certain disorders, such as schizophrenia, appear to be more common among the lower socioeconomic classes. This increased occurrence may be due to differences in lifestyles, in expectations, and in opportunities between the classes. In addition, people may be biased in how they view disorders in different social classes. For example, odd behavior by a wealthy person might be tolerated or viewed as amusing. The same behavior by a person living in poverty might be taken as evidence of a psychological disorder. The biopsychosocial approach recognizes that each of these factors alone can influence psychological disorders. More important, however, is the idea that three factors interact with each other in disordered thoughts, emotions, and/or behaviors. If you have a discolored patch on your skin, a medical test called a biopsy can evaluate the cause. If you have an infection, a blood test will reveal the bacteria involved. Determining whether someone has a psychological disorder is not as straightforward. Clinical psychologists often work like detectives, tracking down information from sources through interviews, self-reports, observations, and psychological testing. This assessment of a person's mental functions and actions allows psychologists to categorize the individual's thoughts, emotions, and behavior in order to make a diagnosis so that the appropriate treatment can be provided. The course of the condition and its probable outcome, or prognosis, will depend on the particular category of psychological disorder that is diagnosed. A correct diagnosis will help the person, and perhaps the person's family, understand what the future might bring. Most psychological problems develop over a fairly long time. Frequently, family members or a physician will notice symptoms and encourage the person to seek help. During the assessment, 3 methods can be used to determine what symptoms the person is experiencing. Once the assessment begins, the person is referred to as a client, not a patient. A psychologist's first step in assessment is often to conduct an interview. That is, the psychology asks the client about current symptoms and about recent experiences that might be causing distress. For example, if someone is feeling depressed, the psychologist is likely to ask whether the person recently experienced some sort of loss, and a self-report can reveal a lot of important information. A psychologist can also gain information through observation of the client's behavior. For instance, a person who avoids eye contact during an examination might be experiencing a social anxiety disorder or have attention deficit hyperactivity disorder. A person whose eyes dart around nervously may feel paranoid. Behavioral assessments are often useful with children. Observing their interactions with other children or seeing whether they can sit still in a classroom, for instance, may tell a psychologist more than the children could. Another way to conduct assessment is through psychological testing. Personality tests, such as those described in the personality unit, are just one example. Other psychological tests ask the client to perform actions, such as copying a picture or placing blocks into slots on a board while blindfolded, that require abilities such as planning, coordinating, and remembering. By discovering actions that the person performs poorly, the assessment might indicate problems with a particular brain region. For instance, people who have difficulty categorizing objects may have impairment in the frontal lobes. Subsequent assessment with brain imaging might show brain damage caused by a tumor or by an injury. Once assessment reveals that someone is experiencing disordered thoughts, emotions, and/or behaviors, the next step is to make a diagnosis in one or more categories of a psychological disorder. Throughout most of human history, people showing signs of what we now consider psychological disorders were viewed as suffering from madness. Their problems were believed to be caused by the gods, witches, or evil spirits. But with the advances in the medical understanding and treatment of disorders, recognition grew that psychological disorders were not caused by these entities. Eventually, doctors such as Sigmund Freud began to study psychological disorders to find out what caused them. In the late 1800s, the psychiatrist Emil Kraepelin noticed that not all patients experienced the same disorder. Kraepelin identified psychological disorders based on the groups of symptoms that occurred together. For instance, he separated disorders of mood, like depression, from disorders that focus on thought disturbances, like schizophrenia. The idea of categorizing psychological disorders symptomatically was not officially adopted until 1952, when the American Psychiatric Association published the first edition of the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM. Since then, the DSM has undergone several revisions and remains the standard tool used by professionals to sort patients' symptoms into categories of psychological disorders. In the current edition, the DSM-5, released in 2013, disorders are described in terms of observable symptoms. A patient must meet specific criteria to receive a particular diagnosis. The DSM-5 consists of 3 sections. 1, an introduction with instructions for using the manual. 2, diagnostic criteria for all of the disorders, which are grouped so that similar disorders are located near each other. And 3, a guide for future psychopathology research that describes conditions that are not yet officially recognized as disorders, such as excessive internet gaming. Scientific research indicates that many psychological disorders occur together even though the DSM-5 treats them as separate disorders. For example, depression and anxiety often are experienced together, as are depression and substance abuse. This state is known as comorbidity. Accordingly, people who are found to be depressed should also be assessed for comorbid conditions. Though they may be diagnosed with 2 or more disorders, a dual diagnosis offers no advantages in terms of treatment because both conditions usually will respond to the same treatment. This unit considers some of the most common psychological disorders that are described in the DSM. The DSM-5 describes 19 major categories of disorders, each of which have several variations or types. Nearly all psychological disorders involve disturbances in how people feel, think, and behave, but emotions are more central to some disorders, thoughts are more central to others, and behaviors are more central to yet others.